Welcome once again. You're tuned in to IRG Health Talk on Smart Talk 570 KVI. We're heard every Saturday afternoon at 3:30 along with Shannon O'Kelly. I'm Tom Hutler. Glad to have you with us. And our next guest in a very esteemed lineup today, we just had Jamie Moyer on, and now Dr. James Andrews, orthopedic surgeon and founding member of Andrews Sports Medicine and Orthopedic Center. And Shannon, as I mentioned earlier, this guy is one of the guys, if you talk about any category of people in a professional world, this is certainly one of the first few names you're going to hear when you talk about orthopedic surgeons.
You're right, Tom. And you know what? I'm excited to have him on. He is started a organization to educate coaches, parents regarding athletic injuries, particularly those that we're seeing in kids that are adult-type injuries.
All right, here's Shannon and Dr. James Andrews.
Dr. Andrews, thanks for joining us today. I appreciate you taking time out of your day. I know you're extremely busy, but I wanted to start out and talk to you about the Stop Sports Injury Campaign. Can you kind of tell us what that is and how it got started?
Well, that's a national initiative that we're having to try to prevent injuries in youth sports. STOP is actually an acronym for Sports Trauma and Overuse Prevention in youth sports. Our motto with that program is to keep them out of the operating room and on the playing field. That program was started by me when I was president of the American Orthopedic Society of Sports Medicine 2 years ago as a national initiative because of the escalation of injuries that we saw in youth sports.
So the purpose of the program is basically kind of twofold. It's education and it's prevention.
Yeah. For example, the Tommy John's ligament injury to the elbow. When that first started, of course, that operation was designed for professional, mature, basically Major League Baseball pitchers. It certainly had nothing to do with any kind of injuries we were seeing down in the 14 and 15 and 16-year-old age groups. In fact, we didn't see that injury. Over the last 10 years, though, we've seen an escalation, just for example, in youth baseball, 5 to 7-fold increase in shoulder and elbow injuries. And now we're seeing what I call adult injuries, like the Tommy John's injury to the elbow down in the young high school age group, even down as young as 14 and 15 years of age. And now the high school age group outnumbers either both the college and the professional age group when it comes to sheer numbers. So the whole thing is flipped upside down. And that's the reason for all the problems and all the worry that we've got with these injuries, trying to prevent them.
And what do you, in your experience, I mean, because this is your area of expertise, orthopedics and sports medicine, in your experience, what do you think the root cause of this increased number of high school athletes or high school and younger athletes that are seeking medical attention for these, what we used to call overuse or adult-type sports injuries?
Well, it's obviously related. 60% of them are related to overuse, and overuse means playing a single sport year-round. Now, that's the number one cause of these problems, and that's what we call specialization. And they're not having any time off to recover from their sport because they're playing year-round. Specialization and what we call professionalism, that means taking a kid and trying to work him as hard as if he was a professional athlete with coaches and special coaches and clinics and showcases and travel ball and specialization produces an overuse injury, and all of a sudden here we are with this escalation of mature injuries at a young age.
And when you say and talk about overuse injuries, these are not injuries that are traumatically caused like a single event. This is an injury or a complaint or a problem that comes over a period of time.
Wear and tear. It's doesn't occur with one episode. You may have one episode where that was the straw that broke the camel's back, but generally it's related to continuous overuse and wear and tear with too much, too soon, too fast.
When I grew up and played sports as a youth, I mean, like you were saying, I mean, you had football season, basketball season, and baseball season, and you stopped in between those seasons, got a little rest, kind of rode your bike around, just had a good time. And today, we have select sports and travel teams, and there's a lot of pressure on these kids and parents.
Well, you're naming the risk factors. You're overtraining in one specific sport, a unilateral sport like baseball, you're overtraining one side of the body. So they're doing the same thing over and over again. So where does the stress go? It goes to the throwing shoulder and elbow. And you're right. The problem is the system. The systems are now like the tail wagging the dog, because the systems dictate what they have to do. If your kid wants to play baseball, for example, if he wants to play soccer, he's got to play year-round to some degree to keep up with all of the activities. The coaches, if they will tell them, well, if you don't join my system and play year-round with me, then you can't play baseball, or you can't play soccer, or you can't play softball. So the systems are dictating this overuse phenomenon. And how do we get the systems under control is the big problem.
And do you have any thought on that?
The hardest people to reach are the associations, the various youth leagues, and the coaches and their systems. Now, we've been able to, for example, pretty well reach out and help with youth baseball in the Little League Association. As a matter of fact, I'm on their board of directors, and they adopted the pitch count rules for youth baseball in the Little League Association. And we're still following that pitch count rule to see if we're able to control the injury patterns in youth Little League youth baseball. And so far, it looks like we've been able to decrease the number of injuries. But they've taken the lead, and their primary objective in what they do in both youth baseball and youth softball is to keep these kids healthy and help prevent injuries. So they've taken the lead in developing the pitch counts that we studied in our research, American Sports Medicine Institute, the research that was done there with us to control the number of pitches that they throw in a season and to give them proper time off. The other risk factors, by the way, in youth baseball are playing in more than one league at the same time. And that, believe me, that happens. They're playing for a high school team on Friday night and a different traveling coach with a different team on Saturday. Please, parents, don't let your kids play in more than one league at the same time.
And as a parent, and for parents, it's so hard to control your kids' wants and wishes. And I guess the point is you have to be the adult and realize that too much, too soon or too fast is not good for these young athletes.
Yeah,
and
most parents don't have a clue that the kid could get injured doing that. So we're trying to educate them. We're not trying to keep the kids, off the playing field. We're trying to keep them out of the operating room so they can play healthy and move up the ladder and go to their top ability for their sport, to exceed in their sport and be healthy.
Well, as a person in this profession of rehabilitation, I can't thank you enough for your time and expertise in this and the educational aspect of it. How would one find out about your campaign or get more information?
Yes, I'm glad you asked that question, because we'd like to gear the parents and the grandparents, the coaches, and the players, too, the young kids, to our Sports Medicine Society's website, and that's stopsportsinjuries.org. We've got all kinds of tip sheets on there, constantly upgrading that information about prevention, and it's good information on some 29 or 30 different youth sports. So parents can at least understand what the risk factors are for a specific sport for their kids, so they can be aware of it and know some prevention tips of how to keep them healthy. So that website, again, is stopsportsinjuries.org.
Excellent job, Dr. Andrews. Thank you again for your time, and good luck in all your educational campaigns.
Well, help us with it. Get the word out so we can try to keep these kids on the playing field and out of the operating room.
We will. Thank you.
Thank you, here.
Wow, that guy has so much information and has had so much experience doing what he does. That's we could have listened to him for 2 hours.
Yeah, he has a lot of knowledge, and he has a lot of experience. If you remember, he's famous for doing a total hip on Bo Jackson, 2 sports star football, baseball.
And that was back when this stuff was somewhat experimental, and he has been at the top of his field ever since. That's a great guest to have on, and we're happy to have him, Dr. James Andrews. We'll come back with a few closing comments as we start to wrap up IRG's Health Talk right after this on Smart Talk 570.